Today I'm going to give you the experience of Healthy Together Victoria from the City of Greater Dandenong experience. So, and I'm going to give you some reflections, a bit of an overview of Healthy Together Greater Dandenong, a bit of a chat about, from my perspective, about whether or not local government is in Victoria is ready for prevention, and what has changed the game for me, again from a local government perspective and particularly a Greater Dandenong perspective. I just realised I didn't even tell people where Greater Dandenong is. So Greater Dandenong is in the southeastern suburbs of Melbourne, probably about 30 minutes from the city, and we have a very diverse population, one of the most culturally diverse in Victoria, if not Australia. And you know, we face a number of disadvantages, but we also have a lot of assets within the community, and that's what we're building on and drawing upon, I suppose, to implement Healthy Together Greater Dandenong locally. So in terms of what we do, I have an amazing team of 12 highly skilled people working across workplaces, children and young people settings, the broader community. We also have someone working in research and evaluation, and also a small team looking at partnerships and engagement. So it's an extremely well-resourced team, something I've never experienced before, and it's been an amazing experience to build the team and try and work out what the bloody hell we're going to do. That's probably been the biggest challenge. So in terms of what we are doing and what we've been doing for the last 18 months, from the Healthy Children and Young People perspective, we've been supporting the implementation of the Achievement Program in early childhood services and primary schools. We're about to work and look at going into secondary schools. We're also working with maternal and child health and play groups and you know, the whole gamut of children's settings. We're creating and building upon networks, so we've got school garden networks. We've got an early years cooks network where cooks from early years services come together to talk about how they can make their menus healthier for the children. And we also have other networks, so there's a family and children partnership network that we're trying to influence, and some of those we're actually running now to I guess, put a greater focus on prevention within those networks. We're also working with key stakeholders to build capacity and make system links. So we're working with Council's Children and Youth team. We're working quite closely with Monash Health, who are our local community health service, right across a number of different people within that organisation. We're working with the local Department of Education, and we're also working with our Healthy Children and Young People steering group. So there's lots and lots of networking that's happening and embedding ourselves within that existing system, I suppose, to identify where we can actually influence the system. We're also collaboratively working to identify and address needs. So one of those that popped up was oral health. Again, as Shelley mentioned, we're not planning as much. We're kind of just going as we identify the needs. And so oral health popped up as a really huge need in the city of Greater Dandenong. And a great outcome of that has been, anecdotally at this stage, that healthy eating has also had an increase in healthy eating in those settings, in those early childhood settings. So even though the first intent was to look at oral health, healthy eating has been a great offshoot of that. So a good example of us trusting that if we get into the system and address some of the anecdotal needs, we'll actually address some of those greater needs, or the broader needs that we're also here to address. In healthy workplaces has been a greater challenge. Obviously in health promotion we've been working in children's services and schools for many, many years, but workplaces has been a little bit of a newer area, and it's taken a lot of networking, a lot of brave, persistent staff to make some headway in this area. So again, we're supporting the implementation of the Achievement Program within workplaces, and we're doing this by showcasing some early adopters. So we've got a number of businesses who've jumped on board really early and have been shown a lot of enthusiasm for working through the Achievement Program, but mostly committing to the health and wellbeing of their staff and the setting, I suppose, that they're in. So we work really closely with those early adopters to ensure that they can lead the way, and it's not us leading the way. We're working closely with Council's Economic Development Unit to influence existing networks and expand their understanding of prevention and get prevention into their language, and hopefully that's working. Again, we're creating and building upon existing networks. There are a lot of existing business networks within the City of Greater Dandenong. We have a huge manufacturing industry in the City of Greater Dandenong, and so tapping into some of those existing networks has been one of the main things we're doing, often on the platform of OH&S, but sometimes not. We have some engagement around, particularly corporate social responsibility seems to be something that we're able to engage workplaces around. So we have a corporate soccer program where we're working with the Big Issue, our economic development unit, and ourselves, where we have unemployed people come and play soccer against some businesses, and that's helping us to engage with businesses, but also engage with some of the more vulnerable people in our community. We're also doing vending machine audits, working with some of the Vic Health walking map grants. So there's lots and lots of different opportunities that we're finding to engage with workplaces, to engage with them first, and then to work with them on what they see is important, and then sneak what we see is important as well in there at the same time. So we also have a number of other initiatives that you may have seen on the Sphere document that Shelley had up before. So we've got Health Champions. We're working with our diverse community to identify champions who will lead action in their community. We don't have a homogenous community in Greater Dandenong, and I'm sure most people probably don't in their own communities, but we have lots and lots of different small communities. We have over 156 different languages spoken. So we have, as you can imagine, there are lots of sort of different pockets of the community. So Health Champions is a really important initiative for us to identify those leaders within our community who will then take messages back to their own communities. We can't profess to know everything and anything, so they're really the lifeblood of this initiative, I think they will become. Healthy Food Connect has been a bit of a local food system mapping exercise, and it's been really useful in terms of identifying regional food hubs, having a think about how the farm to plate kind of concept, I suppose, from a municipality perspective, but also a regional perspective, identifying food deserts, thinking about how we're going to work with places such as IGA, mentioned by Mark before, how can we influence that locally, also food access as well. So that's been a really large piece of work, and I can see the potential for change being huge. It's also been an opportunity for us to collaborate across council with other departments. In terms of, we've got also, I guess, a suite of healthy living programs and strategies. So we're resourcing local key agencies to implement health promotion or prevention initiatives. The Oral Health Program is an example of a healthy living program that we've implemented, but there'll be many, many more. We're looking at the moment at a few of some statewide programs such as infant and those sorts of things. We have an extra challenge in Greater Dandenong in that a lot of the statewide programs don't necessarily translate into our very culturally diverse community. So we're looking to build some of our programs from scratch, coming from the community. And we're also looking through this to influence local government policy and practice to improve people's health where they live, learn, work and play. You're going to hear that a lot from us. So we're looking at community garden policy, walking strategies, healthy by design, having a look at what can we change from a local government perspective, because there is so much ability, I think, to change in terms of policy and legislation from a local government perspective. So that's helping us focus on that somewhat. New to myself, certainly, and a lot of the people in my team, was social marketing. We had a fast learning curve around implementing a local social marketing campaign that complemented a statewide social marketing campaign. The statewide social marketing campaign called Starts With. We then had a local, which was about getting people to think that it start with something small and build it up to something big. Ours was around encouraging local mums and their kids to increase their vegetable intake, and in making it localised, I suppose, we chose some health champion mums to tell their stories about how they get their kids to eat fruit and veg, and that was really successful. They spoke in their own language and in plain speak, so it really resonated with and they were playgroup mums, local playgroup mums, so it worked quite well, and we're still implementing that as we speak. So, in giving this talk, I wanted to reflect a little bit from my perspective, from a Healthy Together Greater Dandenong perspective, is local government in Victoria ready for prevention? We've been legislated in Victoria to develop a municipal public health and wellbeing plan for a number of years, but my reflection was, is this enough? And I feel that from our perspective that no, it's not necessarily enough, but I think that we can't rely only on legislation and existence of a plan alone, but what Healthy Together has done has provided the legs, I suppose, to the plan almost. We've previously at Greater Dandenong been a bit more inward focused with the plan. Healthy Together has helped to put the focus back on the community and changing outcomes in the community and actually doing some of that work. So we've sort of put legs to it. It's also helped us to engage with a lot more local stakeholders in implementation, in addition to the cross-council work that was already happening, the really valuable cross-council work that was already happening. There's obviously the state government and local government responsibility debate mentioned by Mark. So it's always an interesting one, and it's proven to be somewhat of a barrier when working with some of the leaders in my local government. And Mark did mention cost shifting, and I have heard that mentioned a number of times. And it's an ongoing issue, I think, that we will need to work out to go forward and to look at sustainability. I think in terms of we're externally funded at the moment, so we are treated as a project, and I think that in Opal they've obviously had a similar experience. So, there's a clear role for local government in this space. However, more time is needed, I think, to have it truly seen as core business. So it's mentioned in council plans and other strategic documents. However, it's not always translated into action on the ground. And I think often that comes down to resourcing. And Healthy Together has temporarily fixed this problem, but the next challenge is to permanently fix it. So I think we're currently seen as an externally funded project, and the challenge for Healthy Together Greater Dandenong workforce is to embed and change the way local government does prevention, and that is through having it as part of core business and funded as part of core business. I think there's so much potential for change within local government. I think local government is the right place. There's across Victoria, we're influencing the way suburbs are built. I mean, not in Greater Dandenong, but in other areas where we're able to influence that, and we're also obviously influencing environments in which our residents live, learn, work, and play. So there is a huge amount of potential, I think, for change, which is really, really exciting. But what we need is long-term sustained investment to embed this change. So I think that's sort of a bit of a challenge for the future. So what's changed the game for me? Certainly resourcing. Having worked in health promotion for a number of years now, what's really changed the game, I think, is the leadership and investment from the Department of Health. As mentioned previously, we've often had lots of little bits of funding here and there, and we've not been able to have a sustained collaborative approach. So I think some of the partnerships as well, the links they're making at a statewide level, so working with the Department of Education, but also looking at advocating to IGAs and the bigger players that influence some of our behaviours and how we actually live our lives within our local communities. I think workforce as well, so the fact that we have such an investment in workforce, so having a team of health promotion prevention specialists working across council is an amazing experience, one that I've never had before, so I think that's definitely changed the game. I think also the funding model has changed the game. I've touched on funding, but this model takes into consideration the complexity approach and allows us the freedom to work to this model without constant planning and reporting and the constraints that have been in the past. What we know, one-off funding doesn't work. The use of complexity in systems theory. I think admitting we don't know exactly how to fix the problem, otherwise we would have already fixed it, and dealing with the fear associated with this. I think as others have mentioned, it was we were told that we need to have the answers, but we don't necessarily have the answers. So letting go of this and just trusting the system and trusting that we will, the community actually have the answers. We don't necessarily have them. Safe to fail experiments is another one that's helped change it for us. So trying small things and then pushing them aside if they don't work, but upscaling them if they do has been a really important game changer for us. No strategic plans is just awesome. But it doesn't lock us in. It means we can move with the system. We can change, and constant reflective practice is a really important component of this. But the fact that we don't have to work to a strategic plan doesn't necessarily fit within the bureaucracy of local government, but that's another issue. Permission to be creative and work outside the traditional realm of health promotion, I think, has also been a really important game changer. An example being social marketing. Having never really invested a lot in this previously, I think this is an example. And we have the permission just to try new things and in an environment where it is safe to fail. And also, obviously, local government leadership and the increased focus on the municipal public health and wellbeing plan. There's a huge amount of potential for that. So I think that's really also, changed the game from my perspective. So where to from here? For us in Greater Dandenong, we want to embed in local government. We want to become part of core business. We don't. I feel like someone asked me to pictorially represent what I felt like in local government, and I felt like a puppy sitting at the window wanting to come in, but no one would let me in. I want to come in the door, and I want to be in the building. Convincing senior leaders at local government is best place to lead prevention at a community level, and I mean senior leaders within local government. Continuing to build on our use of systems and complexity theory in the field. It's a really exciting time to be in the field, and this, I think, will definitely change the game, and we're going to have positive outcomes there. Contributing to the literature with our learnings, I think, is going to be really, really important, something I'll be encouraging my team to continually think about. And obviously advocating for this approach to be statewide, upscaling this little safe to fail experiment. Thank you.